the cessation of the periods. All right. So the first period is called as the menarche. This period is a part of a cyclical process which prepares the woman's body for the development of the fertilized egg. This process is controlled by different hormones. Okay, the different hormones that are involved in the initiation of the menstrual cycle is the gonadotrophin releasing hormone, GnRH. Okay, I'm sure you must all know that GnRH is released from the hypothalamus. Once GnRH releases, it affects on the anterior pituitary gland and stimulates the release of the follicle stimulating hormone and the luteinizing hormone. Once both of these FSH and LH is stimulated, it in return, it increases the estrogen production in the body and progesterone production. So this is the graphical representation of the ovulation. So we know that primary follicle is formed, that it then develops, then it is surrounded by a Graafian follicle, then the Graafian follicle ruptures and the early corpus luteum is formed. And corpus luteum, if fertilized, it leads to the embryo, and if it degenerates, then the period starts. So the egg matures when the FSH from the pituitary gland reaches the ovary. So FSH is released from the anterior pituitary gland, and when it affects the ovary, a mature follicle is formed. Okay, and as I told you that this mature follicle is surrounded by a jacket of cell that is called as the Graafian follicle. So here you can see it's a Graafian follicle and an egg that is surrounded by the Graafian follicles. So the mature Graafian follicle moves towards the surface of the ovary and ruptures, and it releases the ovum from the follicle and the ovary. This process is called as the ovulation. Usually in a regular cycle, the ovulation occurs at the 14th day of cycle. Okay, the first day of period is called as the day 1 of the cycle. And if the cycles are of 28 days, then the ovulation usually occurs on the day 14 of the cycle. So when the ovum is released, it enters into the oviduct, that is the fallopian tube, and it passes along the oviduct to the uterus. If fertilization occurs, as I told you earlier, if the fertilization occurs, it turns out to be embryo, and if it does not, then it disintegrates into the corpus luteum, and then the bleeding starts. So once the ovulation occurs, the pituitary gland secretes the LH hormone. LH changes the remaining of the follicles into the corpus luteum, that is called as the yellow body. जब patient pregnant हो जाती है, तो this corpus luteum increases the progesterone secretion. Okay, progesterone further thickens the uterine lining and increases its blood supply. Okay, as I told you, if the fertilization does occur, the corpus luteum enlarges and continues to produce progesterone, and the lining of the uterus thickens and the blood supply increases. And progesterone also changes the size of the breast. It leads to the little bit of cramps in the abdomen. And this is called as the pregnancy changes. So basically the progesterone is the hormone that leads to all these changes. Once both the estrogen and progesterones are at peak level, FSH and LH production decreases. That is called as the negative feedback. So there are no further eggs are formed. Okay, if fertilization does not occur, the corpus luteum degenerates to ordinary ovarian tissue and the progesterone levels falls. As soon as the progesterone level falls, the endometrial lining, which is initially very thick and with increased blood flow, it sheds. All right, and then the menstrual bleed starts. So as soon as the menstrual bleed starts, the FSH again started to increase for the production of the egg. So this cycle continues. So we know in the initial phase of the menstrual cycle, the FSH and estrogen are at the peak level. And in the second phase of the menstrual cycle, the progesterone level and LH level is at the peak level. So usually normal menstrual cycle is about 28 days, but it is not compulsory that every patient is facing 28 day cycles. At times the cycle is 21 days, 32 days, 35 days. So normal mean average cycle is of 21 to 35 days. Cycle means after how many days the patient can bleed. Okay, so it varies from 21 to 35 days. Average duration of periods is about 3 to 8 days, and the approximate blood loss is 30 ml, which is a very qualitative type of thing. We cannot estimate the blood loss. And then usually ovulation in a regular menstrual cycle, ovulation occurs on the day 14 of the periods. So I'm sure you people have understood what is menstrual cycle. Now, basically this lecture is about the abnormal menstrual bleeding. Okay. So abnormal bleeding means just any bleeding that is not regular. Like we said, the menstrual cycle should be of 31 to 28 to 35 days cycle. If the bleeding is coming after every 15 days, so it's an abnormal cycle. If the bleeding is lasting only for 2 days, it's an abnormal cycle. If the bleeding is lasting for 10 days or 15 days, it is the menorrhagia. It is more excessive bleeding. So these are the different situations of the abnormal menstruation. So abnormal uterine bleeding refers to the uterine bleeding outside the normal parameters, like the duration is greater than 8 days. As I told you earlier, the duration of the cycle should be 3 to 8 days. If the bleeding is lasting for 10 days, it is a heavy period. If the flow is greater than 80 ml per cycle, okay. See, no one can measure the menstrual blood. Okay, so अब इसके लिए हम कैसे पूछते हैं पेशेंट से? हम पूछते हैं how many pads you are using per day. If she says I am using 10 to 12 pads per day, so number of pads are more. और कितने फुली सोक्ड होते हैं, आपका ट्राउजर वेट तो नहीं हो जाता, डू यू is it the bleeding is affecting your quality of life, you cannot go to your job while you are menstruating. So these type of questions we do ask from the patient. So it occurs more frequently than every 24 days or less frequently than 38 days. If it is occurring earlier than 24 days, and if it is more than 38 days, it is oligomenorrhea. Intermenstrual bleeding. That intermenstrual bleeding means bleeding between the 2 cycles. Okay. Postcoital bleeding means bleeding after the intercourse, or absence of periods. Absence of period means amenorrhea. So these are the different terminologies. These are the different abnormal uterine bleeding जिसको हम कह सकते हैं. So etiology, ठीक है. Etiology of abnormal menstrual bleeding की etiology क्या है? देखिए, जैसे मैंने आपको बताया कि क्या क्या चीजें इन्वॉल्व है एबनॉर्मल यूट्राइन ब्लीडिंग. अगर नॉर्मल यूट्राइन ब्लीडिंग में हमारा, अगर हम हाइपोथैलेमस से स्टार्ट करें, जहां से GnRH निकल रहा है, GnRH नहीं निकल पा रहा, पेशेंट विल हैव नो पीरियड्स. अगर कोई प्रॉब्लम है एंटीरियर पिट्यूटरी में, FSH नहीं निकल पा रहा, देयर विल बी नो ओव्यूलेशन. ओवेरियन प्रॉब्लम है, ओवेरियन पैथोलॉजी है, फॉलिकल्स नहीं बन पा रहा है, डेफिनेटली देयर विल बी नो पीरियड्स. यूट्रस में कोई प्रॉब्लम है, देयर विल बी मोर पीरियड्स और लेस पीरियड्स. सो जो पूरा साइकिल है ना, मतलब हाइपोथैलेमस, एंटीरियर पिट्यूटरी, ओवरी, यूट्रस, वजाइना, इनमें से किसी भी चीज के अंदर कोई प्रॉब्लम होगा तो इट कैन लीड टू द एबनॉर्मल यूट्राइन ब्लीडिंग. Etiology means causes of abnormal uterine bleeding. So इसको हम जब define करते हैं तो हम इसको कहते हैं palm coin, PALM, okay, and COEIN. Palm means the structural causes that you can identify a organic cause. Like मैं अल्ट्रासाउंड करा रही हूँ तो मुझे अल्ट्रासाउंड के अंदर एक यूट्राइन फाइब्रॉइड नजर आ रहा है, ठीक है. सो इट्स अ स्ट्रक्चरल कॉज. और नॉन स्ट्रक्चरल कॉज दैट no organic pathology is visible. Okay, सो पाम को अगर आप देखें तो P फॉर पॉलिप, A फॉर एडिनोमायोसिस, L फॉर लियोमायोमेटा जिसको हम फाइब्रॉइड कहते हैं, M फॉर मेलिग्नेंसी और एंडोमेट्रियल हाइपरप्लेसिया. दिस इज द इजी वे ऑफ रिमेम्बरिंग दिस causes of the abnormal uterine bleeding. जब आप पॉइंट को वो डिफाइन करते हैं तो C फॉर कोअगुलोपैथी, O फॉर ओव्यूलेटरी डिसफंक्शन, जैसे आप लोगों ने शायद कभी नाम सुना हो पॉलिसिस्टिक ओवेरियन डिजीज, ओके, प्रीमेच्योर ओवेरियन फेलियर. सो these are the causes of the abnormal uterine bleeding due to ovulatory dysfunction. Endometrial causes or iatrogenic causes or some of the causes that are not yet classified. We don't know exactly what is going on with the patient. So these are the anatomical causes. Anatomical causes means there is a problem in the uterus, okay, cervix or the vagina. So anatomical causes में आ जाता है infections. Cervicitis means inflammation of the cervix. Okay, so whenever there is an inflammation of the cervix, patient may presents with the intermenstrual bleeding, that is the bleeding between the 2 cycles, or irregular menstrual cycle, postcoital bleeding, all right, and endometritis. Endometritis means there is an infection in the endometrial lining inside the uterine cavity. It also presents with the heavy vaginal bleeding. Okay. Other anatomical causes are the endocervical or the endometrial polyps. Okay. So endocervical or endometrial polyp means there is a outgrowth of the tissue in the uterus or the cervix. Okay. So these polyps are, they cannot be seen, the endometrial polyps, the polyps that are inside the endometrial lining, they cannot be seen on the examination. They can only be seen by the ultrasonography. That मतलब हम जब अल्ट्रासाउंड कराएंगे उस पे हमें एंडोमेट्रियल पॉलिप नजर आएगा. लेकिन अगर आप ये देखिए सर्विक्स में से जो ये प्रोट्रूड कर रहा है पॉलिप, इसको जब हम पर स्पेकुलम एग्जामिनेशन करते हैं, सो वी कैन सी दिस पॉलिप. ठीक है, दीज आर द एनाटॉमिकल कॉजेस. उसके बाद आ जाते हैं फाइब्रॉइड्स. ठीक है, या फिर इनको हम कहते हैं लियोमायोमेटा, लियोमायोमा. So these are the different types of the fibroids. So you can see one fibroid inside the uterine cavity, that is the submucosal fibroid. That is the outside the uterine surface is the subserosal fibroid, and these one that are lying between the lining of the uterus are the submucosal fibroids. Okay, so whenever there are different types of fibroids are there in the uterus, they increases the surface area of the uterus, and the patient usually have the abnormal uterine bleeding in the form of heavy periods. So now the types of the bleeding. Okay, types of the uterine bleeding are the amenorrhea. These are the different terminologies that you see when you see different patients. Okay, amenorrhea means absence of periods, no periods. Okay, so amenorrhea can be of primary or secondary type. Primary amenorrhea means the patient has never menstruated, and the secondary amenorrhea, patient को periods आया और उसके बाद all of a sudden there is a cessation of the periods. Okay, hypomenorrhea means scanty periods. Scanty periods means patient का cycle बिल्कुल regular है, लेकिन जो उसका flow of blood is less than the normal. Oligomenorrhea means there is the infrequent periods and the cycle is coming after 35 days. Normal cycle was of 27 to 31 days. So in oligomenorrheic patient, the bleeding comes after every 35 days. Menorrhagia means excessive periods. The cycles are regular, but the bleeding is very heavy. Then the metrorrhagia, bleeding between the periods, that is intermenstrual bleeding, or the menometrorrhagia is a heavy bleeding during the and between the menstrual period. So आप लोगों के लिए जो important terminologies हैं जो आपको पता होनी चाहिए वो amenorrhea है, oligomenorrhea है, menorrhagia है. ठीक है? So amenorrhea means absence of periods, oligomenorrhea means when the cycle is of more than 35 days, and menorrhagia means that the cycles are regular but the bleeding is very heavy. So हम one by one इसको देख लेते हैं. तो जैसे मैंने आपको बताया, एमेनोरिया मीन्स नो ब्लीडिंग. Okay, and there are two types of amenorrhea, primary amenorrhea and secondary amenorrhea. So in secondary amenorrhea हम किन पेशेंट को लेबल करते हैं जहाँ पे पेशेंट का cessation of periods हो चुका हो for more than 6 months. Okay, so causes of the amenorrhea can be congenital absence of the uterus, that is called as the Rokitansky syndrome. So when there is no uterus, although hypothalamus is there, GnRH is releasing, ovaries are there, pituitary gland is there, but there is no uterus. So where these hormones are going to affect? Okay, so whenever there is a congenital absence of the uterus, the patient will be amenorrheic. There are hormonal disturbances. So आप देखिए hypothalamic pituitary ovarian axis में कहीं भी अगर hormonal disturbances होंगी तो वहां पे patient amenorrheic हो जाएगा. ठीक है, let's say कि patient का FSH निकलना बंद हो गया. ठीक है, so no FSH, no estrogen, no ovulation. Failure of the ovary to receive or maintain egg cells, जिसको हम कहते हैं कि premature ovarian failure. तमाम all ovarian eggs are exhausted, no eggs. Okay, so no eggs, no periods. And then there are certain genetic diseases like 5-alpha reductase deficiency, or there are different trisomies. So we are not going into those details. Okay. So these are the different causes of the primary amenorrhea: excessive weight gain, congenital abnormalities of the reproductive system, stress, excessive exercise. So I think these are not very important. Secondary amenorrhea is more important for you people. Whenever the patient is breastfeeding her baby, okay, जहाँ भी patient breastfeed करता है वहाँ पे क्या होता है? Prolactin का हार्मोन increase होता है. जहाँ भी प्रोलैक्टिन का हार्मोन इंक्रीज होगा, प्रोलैक्टिन हार्मोन इज इंक्रीज इन द ब्लड, देयर विल बी नो ओव्यूलेशन. ओके, नो ओव्यूलेशन, सप्रेशन ऑफ द एस्ट्रोजन. Due to the suppression of the estrogen, there will be no ovulation. So one of the cause of the secondary amenorrhea can be breastfeeding. So whenever a patient is coming to you with the absence of periods, so history is very important. Okay, then the emotional stress. ठीक है, सडन वेट लॉस है, एग्जाम्स का स्ट्रेस है, या कोई भी ऐसा इमोशनल ट्रॉमा में से गुजर रहा है, उसकी वजह से पीरियड्स आपके डिस्टर्ब हो सकते हैं. यूजुअली सेकेंडरी एमेनोरिया होता है. मेल न्यूट्रिशन, सडन डिक्रीज इन द वेट. ठीक है, आपका खाना पीना कम हो गया है स्ट्रेस की वजह से, किसी भी वजह से मेल न्यूट्रिशन है, या आप ओवरवेट हैं. ओवरवेट पेशेंट्स यूजुअली आजकल क्लिनिक्स में हमारे पास ओबेसिटी इज वन ऑफ द मेजर बर्डन. Okay, and most of the females who are overweight, they present with the secondary amenorrhea, that is nowadays called as the polycystic ovarian syndrome. Then depression and pregnancy. Any woman who is of reproductive age group who has previously normal periods and now presents in the clinic with the secondary amenorrhea, always we should go for a pregnancy test. So thyroid abnormalities, hyperthyroidism or hypothyroidism, both of these conditions are related to the problems with the periods. Okay, hypothyroidism matlab thyroid function is not, the TSH is not coming out. Okay, and no thyroid is not working. And hyperthyroidism means thyroid is working more. Hyperprolactinemia, as I told you, because during breastfeeding there is a increase in the prolactin hormone that suppresses the estrogen production. So at times the patient is not breastfeeding, but despite she has hyperprolactinemia. So because of the hyperprolactinemia, the patient can have cessation of periods. Rapid weight gain or rapid weight loss. Chemotherapy or radiotherapy, especially if it's a pelvic chemotherapy or pelvic radiotherapy, it can lead to the secondary amenorrhea. ठीक है, कीमोथेरेपी और रेडियोथेरेपी का वो आप लोगों को पता होगा. अगर आप लोगों को कोई चीज समझ नहीं आ रही तो एट द एंड ऑफ द लेक्चर यू पीपल कैन आस्क. किडनी फेलियर हो, उसकी वजह से पेशेंट सेकेंडरी एमेनोरिक हो सकता है. पोस्टमार्टम पिट्यूटरी नेक्रोसिस बिकॉज ऑफ द पीपीएच और अर्ली मेनोपॉज. अच्छा जी, हाइपोमेनोरिया. हाइपोमेनोरिया मींस the periods are regular but the bleeding is very mild. It's just like spotting. ठीक है, the possible causes include the cervical stenosis, or the uterine synechitis, that is also called as the Escherman syndrome, and very less likely with the oral contraceptive pills. So cervical stenosis का मतलब है कि जो cervix है, that is the mouth of the uterus, is very tightly closed. Usually it is very rare type of a thing. Cervical stenosis is not a common thing, but yes, Escherman syndrome is one of the common thing that leads to the hypomenorrhea or the absence of periods. Escherman syndrome, whenever we are performing any surgery on the uterus, especially DNE after miscarriage, if we do endometrial curettage very vigorously, it can lead to the Escherman syndrome. So, as I told you earlier, causes of hypomenorrhea are the Escherman syndrome, or patient is already anemic, very low body fats. This is the uterus, and this is the mouth of the cervix. This is the mouth of the uterus, that is called as the cervix. Oligomenorrhea means the periods are regular, but the periods occur more than 35 days apart. Okay, so this is called as the oligomenorrhea. Possible causes of oligomenorrhea are the anovulation, which may be due to any endocrine problem like pregnancy, menopause, pituitary, any problem in the pituitary ovarian hypothalamic axis, or the systemic causes like excessive weight gain or the estrogen secreting tumor. So menorrhagia. Menorrhagia is the definition of menorrhagia is bleeding that is of more than 100 ml or prolonged cycle of more than 7 days. The excessive volume and duration of the flow, but the cycle is regular. That is, it is coming after every 28 days or 29 days, but the duration of the flow is very long. Okay. So the etiology of the causes of the menorrhagia are, it can be systemic causes, local causes, or the treatment related. Systemic causes का मतलब कोई ऐसी disease जो कि पूरी body पे effect कर रही है, ठीक है? Like hypothyroidism, thyroid is not working properly. Patient is on some anticoagulant therapy, or the patient has some coagulopathy, okay, or diabetes, or the obesity. These are the causes of the systemic causes of the menorrhagia. लोकल कॉजेस का मतलब कि यूट्रस ट्यूब्स ओवरीज के अंदर कोई प्रॉब्लम है जिसकी वजह से हेवी पीरियड्स हो रहे हैं, वो जैसे पॉलिप हो गया, एंडोमेट्रियल कार्सिनोमा हो गया, सर्वाइकल कार्सिनोमा हो गया, फाइब्रॉइड्स हो गए, एडिनोमायोसिस. ओके, these are the local causes of the menorrhagia. And the treatment related intrauterine contraceptive device, इसको आप IUD नहीं कहते, इसको हम कहते हैं IUCD. I'm so sorry, I have not entered C in this. IUCD means intrauterine contraceptive device. It is a device that we placed inside the uterine cavity for the purpose of the contraception. So whenever we place the intrauterine contraceptive device, there are chances that patient may bleed heavily, but cycles will be regular. And if the patient is on some anticoagulant therapy, okay. So these are the medications that can lead to the heavy menorrhagia. Anticoagulants like aspirin, warfarin, heparin, steroids, hormone, or the chemotherapeutic agents, or the intrauterine contraceptive devices. Okay, the signs and symptoms of the menorrhagia. Usually the patient presents with the heavy bleeding during the periods. She says, whenever I start my periods, the bleeding is very heavy and I feel so lethargic. I cannot move around. I cannot do my daily activities. There is a flooding of blood, and there is a clotting in the periods, and she changes her pads very frequently, and at times she feels pain. So these are the symptoms. एंड सिम्टम्स मतलब जो पेशेंट जिस चीज के साथ प्रेजेंट करता है हमारे पास, ठीक है, और साइंस क्या होंगे जो कि डॉक्टर पेशेंट के अंदर सेस करता है. तो यूजुअली अगर पेशेंट को बहुत हेवी ब्लीडिंग हो रही है तो वो एनेमिक होगा, और जहां भी एनेमिक होगा तो वो पेल लुकिंग होगा. उस पे पेल लुकिंग जो चेक करते हैं वो कंजक्टिवा पे चेक करते हैं, माउथ पे चेक करते हैं, नेल्स पे चेक करते हैं, ठीक है. सो अब डायग्नोसिस हमने कैसे करना है, अब डायग्नोसिस और ट्रीटमेंट की बात आ गई है। ये हमें पता चल गया कि डिफरेंट कॉजेज हो सकते हैं एबनॉर्मल यूट्राइन ब्लीडिंग के, लोकल कॉजेज हो सकते हैं, सिस्टमिक कॉजेज हो सकते हैं, और एट टाइम्स ड्रग इंड्यूस्ड हो सकते हैं। डेफिनेशन भी हमें पता चल गई है। So diagnosis of the abnormal uterine bleeding always starts with the history and the physical examination. ठीक है, पेशेंट आपके पास आ रहा है हैवी ब्लीडिंग के साथ, वो हिस्ट्री देगा, उसके बाद आप फिजिकल एग्जामिनेशन करते हैं। देखो हैवी ब्लड लॉस, जैसे अगर कोई भी आपको, आप ये नहीं कहेगा जी मैं 80 ml ज्यादा मेरा ब्लड लॉस हो रहा है, ठीक है। सो आप उसको असेस कैसे करते हैं? एट टाइम्स आपके पास क्लिनिकल पेशेंट आते हैं जो कहते हैं हमारे, हमें बहुत ज्यादा हैवी पीरियड्स आ रहे हैं, लेकिन जब आप उनका हीमोग्लोबिन चेक करते हैं तो वो हीमोग्लोबिन 12 या 13 आ रहा है, विच इज एब्सोल्युटली नॉर्मल। सो वो एक सब्जेक्टिव टाइप ऑफ कंप्लेन होती है। सो आफ्टर टेकिंग हिस्ट्री यू डू द फिजिकल एग्जामिनेशन। फिजिकल एग्जामिनेशन में आप जो फिजिकल एग्जामिनेशन करते हैं टू असेस फॉर द दैट वेदर द पेशेंट इज पेल लुकिंग और नॉट, और एब्डोमिनल एग्जामिनेशन करते हैं ताकि आपको पता चल सके कि कोई एब्डोमिनल मैस तो नहीं है, कोई यूट्राइन मैस तो नहीं है, कोई यूरिन पैथोलॉजी तो नहीं है। And then you offer the per speculum and the bimanual vaginal examination. In per speculum examination, we will assess the cervix. We will look for any abnormal vaginal discharge or any cervical polyp or anything which is abnormal. And in the bimanual vaginal examination, we will look for the size of the uterus, how mobile the uterus is, and the adnexas, whether they are clear or not. So after doing history and physical examination, then comes the pap smear examination. So while we are looking for the cervix, at that time we take the pap smear. Pap smear is a routine investigation that we do for the screening of the cervical cancer. Okay, then comes the pelvic ultrasound scan. Okay, if you cannot see any pathology, like cervix is absolutely normal looking, and there is no abnormal discharge coming from the uterus or vagina, then you offer the pelvic ultrasound scan. So you look for any fibroids that are inside the uterine cavity or any endometrial polyp. Okay, so according to the ultrasound scan, then you will offer a treatment to the patient. So if there is an endometrial polyp in the endometrium, then you will go for the hysteroscopy. Okay, and if there is some other problem, then you can go for DNC or hormonal profile or the blood test. Depending upon her history and physical examination, you will offer all these investigation. These investigation will be targeted according to the patient complaint. Let's say if patient says, yes, I am bleeding very heavily, but I am also feeling that I am unable to sleep, and I'm severely constipated, my weight is increasing. So you will think about the thyroid function along with the menorrhagia. Okay, if the patient presents with there is a amenorrhea and there is a discharge from the breast, then you will think about the hyperprolactinemia. Okay, so all these investigations are not targeted for each and every patient. You tailor these investigations according to the history and the physical examination of the patient. So this is the by which we do the pap smear. This is the mouth of the cervix, and the spatula is inserted at the squamocolumnar junction, and then we take the scraping from this area, and then we send it for the testing. This is a mandatory test for the screening of the cervical cancer. Okay, so now the management. See, the management will be according to the cause. Like if the cause of the bleeding is